Finally, we are back with today's video, and in today's video, we are going to talk about an important topic, that is uterine fibroids. So, first of all, let us know what are uterine fibroids. Uterine fibroids are growths that develop on the wall of your uterus. These growths, they are not cancerous. These growths are not cancerous, and they can vary in size. Like sometimes they are small like a pea, or they can be bigger like a grapefruit, or equal to a size of a watermelon also sometimes. These uterine fibroids, in many cases, they don't trouble you, and the women, they just don't know that they have uterine fibroids. And in some cases, they do trouble you. In some cases, the uterine fibroids, they grow slowly, and in some cases, they grow very quickly. But actually, the uterine fibroids, where they are located, that matters a lot. If the uterine fibroids, they are present outside the uterus or on the outer wall of your uterus, they usually don't trouble you much. But if they are present on the inner wall, they start troubling you. These uterine fibroids, they don't increase your risk of getting cancer, or they sometimes they don't trouble you. But in cases where the uterine fibroids are in the uterine wall, they do trouble you. In other cases, what they do, they cause pelvic pain, they cause heavy period bleeding, they cause bleeding between your periods also. They also cause back pain, and in some cases, they cause miscarriages, or in very few cases, they cause infertility. Very few cases, okay? And this infertility, this can also be treated. So however, many people with fibroids don't have any symptoms at all. They don't know that they have fibroids. It is just that on a routine ultrasonography or on a routine sonography, they come to know that they have fibroids. And these fibroids can happen at any age, but you are more likely to get them as you get older. Okay, as you get older, you're more likely to get them, because when women, they get older, they tend to put on weight. So this, the weight gain factor is, it is a cause of many disorders, of many diseases, many problems in women. So the first thing that you should do is control your weight. We'll talk about this weight factor in the end part of the video. In the last part, first we'll talk about uterine fibroids. Many times, people, they ask that when are these uterine fibroids usually going to shrink, or when I'll get rid of these fibroids. Naturally, after menopause, these fibroids, they usually shrink. After menopause, they shrink. But in the age group of 30 to 40, they are most common. And after menopause, they shrink. Now, who are at a higher chance of getting uterine fibroids? Who are at a higher risk of getting uterine fibroids? So, number one is that genetics, they play an important role in this uterine fibroids, especially if your mother is having uterine fibroids. The daughters, they usually have uterine fibroids. The second important risk factor is that obesity. If you're obese, you are at a higher risk of getting this uterine fibroids. Third thing is that people who eat lot of red meat, a lot of junk food, lot of fried food, they are at a higher risk of getting this uterine fibroids. Fourth thing is that some women, they always stay indoors, they don't go out, they don't get that enough vitamin D, the early morning sun, they don't expose themselves to that beautiful early morning sunlight for vitamin D. So these women, they are at a higher risk of getting uterine fibroids. Now let's see what causes uterine fibroids to grow. Usually genetics, hormones, diet, and your stress. These entire combination, they play a part in this uterine fibroids. And the most important is genetics. The second important is your hormones, because fibroids usually, they are controlled by your hormones. Which hormones? Estrogen and progesterone. These uterine fibroids, they grow when your hormones are at high levels, like during pregnancy, and they stop growing or they shrink when people use like anti-hormone medication, or I have already previously mentioned about menopause. Like when you are going through menopause, these uterine fibroids, they shrink because of lesser levels of hormone. Now let's talk about the treatment plan. The first thing is that the treatment is surgery. You need to consult your gynecologist. But now in this video, today in this video, we are talking about home remedies or how to treat the underlying causes. Now, what are the underlying causes? That is obesity and all. So first we'll see that, because the other treatment is surgery, so I'm not talking much on that today. But I'll be talking on the home remedies and how to treat your underlying causes. Number first thing is that you should lose your weight. You should try to lose your excess weight. If you're obese, you should try to lose your weight. You should try going to gym. You should try doing sport exercises, doing jogging, doing walking. The second thing is that you should expose yourself to the early morning beautiful sunlight, which is soft sun rays. You should expose yourself to that, because vitamin D is very important for a woman's body. And you should these days many women, they suffer from vitamin D deficiency. Many women, they go to work so early morning, they are busy in their kitchens and all, and they miss this early morning beautiful sunlight. So it is very important for you to expose yourself to this early morning beautiful soft sun rays, which help you with the vitamin D deficiency. The third thing is that include lots of fiber in your diet, include lots of fruits and vegetables in your diet. Just cut off that junk food, that fried food, which will make you obese, which will help you to put on weight. Just cut it from your diet and include a lot of fiber in your diet. Now, these are the home remedies which can treat the underlying causes. If you just straight away, if you want to treat the uterine fibroids without going for underlying causes, so that is not going to help you much. You first have to go with these basic steps, and then you can go and consult your gynecologist, and then you can go for a surgical treatment to remove these fibroids if they are troubling you. So I hope that this video was useful for you, and if you want more such informative and useful videos, don't forget to subscribe to our channel. And if you like the video, don't forget to hit the like button and share your experiences in the comment section below. Till then, take care. Bye bye.